What's up, everybody? Good morning, and welcome to another edition of the Brothers of Legacy. Got the alfalfa happening right there. Welcome, everybody. Make sure you share. Sharing is caring. Thank you for being a part of all that we do. We are on here every morning, Monday through Friday at 9 a.m. So this is your opportunity to share. Let the world know that the brothers are on. Tag somebody. Let everybody know. We're going to have an amazing conversation today. We have my brother Reggie Johnson from CareSource coming through to talk about health insurance. Blessings, Lisa. Thank you for always rocking with us and sharing. So we're going to have a great conversation tonight. Just a little bit. I don't know if you can hear me good. But yes, we're going to have a great conversation. May have a special guest rolling through as well. Someone we haven't seen on the broadcast in quite some time. So we're going to see how it rolls, see how we get down. So this is your opportunity to share, because sharing is caring. Sharing is caring. Again, I appreciate you guys for always being here, being a part of what the brothers are doing. That's it. And listen, if you feel like you are missing out on all that is going down with the Brothers of Legacy, be sure to connect to our text. Text LWN to 84576. Text LWN to 84576. Never miss a broadcast. Never miss an episode happening with the Legacy Walker Network, because we have some things we're working on coming down the pike. Trying to expand out a little bit, be more open. Yes. All right. Let's do this. Who is that? Hey, Mama Corey. Great morning to you. Great morning to you. Thank you for being here. All right. Let's see. All right. So, without further ado, we're going to get ready to get started. I think I sent all my links out. Everybody is on the know. It's going to be here. It's going to be here. And we're going to go ahead and get ready to get started. Real quick, before we go ahead and kick it off, did you know that Capitol Records signed their first AI artist? Did you know that? I just found that out today. Capitol Records signed their first AI artist. It's called FN Mika. Now, apparently, this artist, who of course is a real person behind, but all you see is the AI, has over 10 million followers on what's that space? TikTok. Has over 10 million followers on TikTok. Let's see, Reggie. 10 million followers. And apparently first signed and the first artist dropped. He didn't last long because apparently apparently the way he looks is whitish. Actual artist, I think, is white, and he's used the N-word several times and derogatory messaging. So it's very interesting. Very interesting. So that's just a little, if you wanted to know, now you know, moments. That's gonna be my segment. If you wanted to know, now you know. So that was kind of an interesting situation there. So we're gonna get ready to kick it off. I got my man Reggie hanging in the ring. I guess my other folks is running late. You know how we do. Everybody got a lot of stuff happening, going on. So they will be in momentarily. And on me, I sent the link out just a tad bit late. So I probably hit some folks last minute. They're like, come on, brother. All right. So we're going to go ahead and kick this off. Get our quick 10 seconds intro. So Reggie, be ready. We're about to put you on. And again, this is your opportunity to share, tag somebody. We're about to dig into the health insurance space. I got some questions on deck. Make sure you guys out there have some questions on deck as well. All my replay people, just put some questions in there later. I can definitely have Reggie address those and send them to him if you have any questions concerning health insurance. All right. So without further ado, if we have shared already, let's go ahead and kick this off. Spliggity splow right here. All right, let's put that. All right, let's go.
You're watching the Brothers of Legacy. We don't stand out, we stand up.
Bam! Good morning. Good morning.
Hey, good morning.
How's it going, Mr. Reggie?
Man, I'm awesome. How about you?
I'm doing well, man. I can't complain. I can't complain.
Good morning, all. Everybody's watching. How y'all doing?
Yes, indeed. So let's see. Been a long time coming. Seen you in several different spaces.
Yes, sir.
Kind of wanted you on for a minute, and you was like, I was trying to see if I can get on. Like, okay, let's make this thing.
Yeah, right.
Like, every time because it's like I see everybody else. It's like, hey, where Big Man go? Where'd he go? Like, oh man. Like,
Yeah.
you know?
Well, here I am. We here now. Happy when it was supposed to happen.
Yes, indeed. All right. So, you are you operate a care source office here in Georgia.
Yeah. Well, yeah. I am a community marketing representative.
Okay.
Care source. Yes.
Okay. Break that down. Community marketing representative.
So essentially, my job is to do this.
Okay.
To create, build partnerships and create relationships to let people know who Care Source is and what we do. Because Care Source it's not a new company. Based out of Ohio, it's been around for like 2 years now. The number I've been with Care Source for 5 years, so it's like when I came, it was less than 30. Now it's over 30, and we operate in 7 states now. So and in Georgia, we do insurance for families to get Medicaid, peach care for kids. Women get Planned Parenthood babies. We also do Marketplace and Medicare.
Nice.
So with us being such a in such a competitive market, being a new name, we needed. So it was my job for the past 5 years to go out and introduce Care Source to people. Especially with our Medicaid population, the way people come on, because we're part of Georgia Families Program. And in the state of Georgia, once you get approved for Medicaid or peach care, you're automatically assigned to one of the health plans. So if it's your first time, or if you're from a state that doesn't do managed care, you're going to start getting bombarded with a lot of things in the mail, and it could be confusing. So let potential members and new members and whatnot know about what to expect and the benefits that we have, and ways if they are our members, I can let them know how to utilize our benefits, and if they're not our members, I can let them know how to become our members. Nice. And that's on the Medicaid space, and with the Marketplace, aka Obamacare. I can go out and do that. I'm licensed to I'm licensed to sell it. I'm also licensed to sell the Medicare product, but my primary focus is marketing.
Okay. Awesome. Yes. Awesome. How did you get into this space? Like, how did you happen upon it? Did it come to you?
Yeah, it is crazy, because I literally ended up at Care Source almost by accident.
Wow.
No, not almost by accident. Yeah. I've been working in the community in Metro Atlanta my whole life. I'm a native. Just from being young, I never really saw myself doing anything, like being an accountant or being I've tried to do those things, but it's always been helping out, organizing events, working things like that. So that's always been something that I've done. And I've worked with numerous organizations over the years, and I actually worked with Georgia Families when it first started, which because I did breast cancer outreach for Emory for 10-12 years. And I came over to Georgia Families the first time I left pursuit of the interest. And my last job, I was actually working at Aetna, another insurance company. Yeah, just doing customer service, and actually found out about the opportunity with Care Source. No idea who Care Source was. I went on the website, read the job description, and I guess I read it wrong, because I didn't think I could do it the way it was worded. I said, I can't do this. But my friend, my former coworker, she was like, apply for it anyway. So I applied for it, found out what it was, and the rest is history. And I've been here 5.5 years.
Nice. All right, so let me jump into some of the questions we can kind of chat about. The first one, so all of us have had some level of insurance, have it. What is the need to pay deductibles? Why can't I just make my payments right, to the insurance company,
So,
whether through my job or directly, and them jokers just cover what they cover.
So I have been working in the insurance industry for coming up on 10 years now.
Okay.
And I can honestly tell you, it wasn't until the beginning of 2020 that I really understood. And this is working and having insurance, because it can be,
yeah.
And what it is, nobody really, understands the process, or the way it's been explained.
Okay.
Isn't clear. So, essentially, just break it down. It's expensive to go to the doctor.
Right.
And that's because it's expensive to become a doctor, and it's expensive to be a doctor, because, if you want to be a doctor, by the time you come out of med school, you are already like over $100,000 in debt.
Right.
And then you're gonna have to work years, and for relatively low pay, because doctors can like 12, 18-hour shifts a day.
Right.
And then you got all these other things. And then after you do that, if you want to go into private, so then you have to have a space, and you got to keep your licenses and training. You got to make sure you have the latest equipment. So
it's funny that you say that, because you always, we're always taught, be a baller, be a doctor or a lawyer. And it seems the older I get, the more I realize those two professions folks have struggled in.
Listen, my cousin is a lawyer, and I can remember, I swear, when he graduated from law school, the first thing he told the family, he said, "No free legal advice, because I got to pay these loans back."
I got to pay these loans back.
And it's funny, because when on one aspect you hear the term "more money, more problems," and people they'll say, "Well, forget that." But I've experienced that. Like, again, I'm not balling by any stretch of the imagination. But I remember when I first worked at Georgia Family, because I worked for the enrollment broker, so we would actually do the enrolling. And the CMOs at the time, because there were 3 back then. And our counterparts, the marketing reps for them, like at the company we worked for, we knew that they made more money than we did. And so in my mind, I was like, I need to make more money. I wish I had, the thing. So I left there. Then when I came to CareSource, and I was a CMO like my counterparts back in the days, and I actually had that job, and I see the amount of work that goes into that extra money, So being a doctor is expensive. So seeing a doctor is expensive. And there's a way. So, and there's no way to get around it. Like, everybody is like, you have to, like, your health is the only thing that you have that matters. And people, they pay car insurance. They have no problem with that. You have like everything. But if you crash your car, no matter, it may be expensive, but you can replace that. But if you have and a lot of diseases people suffer from are chronic, and are preventable. And so with proper medical care, so it's expensive. So if it's expensive to see a doctor with insurance, imagine what it's like to see one without. So so and this is a capitalistic society. So of course the insurance companies have to make money, the doctors have to make money, and you want to save money. So the way that the way it is structured, the way it's supposed to work, and I put that in quotation marks. So the insurance, has been, and that's where the network comes in. They have the network of doctors, and they'll say, well, if you accept our insurance and meet these criteria and see our patients, they negotiate a rate, and then the member has to, I guess they call it, has to have some skin in the game, because just like you say, if it's if you could just go to the doctor whenever you wanted to, like I guess every little thing, that there's such thing as overutilization. So it's like you want to make the doctor accessible, but you really only want to make it to where you go to the doctor when you absolutely need to.
Outside of regular checkups. And
so and you mentioned that, so like your basic things like your annual physical, your eye exam, your dental exam, like things like that, you get free every year.
Right. Oh, okay. I see where we're going. Okay, but go ahead.
So,
Okay.
And so, and I guess leading into, because I was looking at some of the questions, and so the idea about deductibles is like I say, that's a way to spread the costs around, because like the costs are there. So the way health insurance usually works is the company will charge, so there's a risk pool. So they'll look at the and I can't remember if it's by zip code or whatever. They'll look at the number of diseases or whatever, or chronic ailments, environmental factors of an area. So if you live in an area where everybody around you is unhealthy, it's just like car insurance. If you live around a place where everybody's crashing into stuff, your premiums are going to be higher than wherever you live. So like if you live, and especially a lot of us in the areas where we live in lower income, a lot of us don't necessarily take care of ourselves. The risk factors out, the zip codes are higher.
Wait, hold on, stop, slow down. Wait a minute. So, like car insurance, where I live, matters with health insurance as well.
Yes.
Wow.
Because, so
y'all know that, guys? Did y'all know that? Wow.
Yeah, I mean, insurance is insurance, just like life insurance. If you live in an area where you probably, where everybody or people around you usually die before they're 50, then they say like the likelihood is you. So we we gotta make that back. And so it's so that's how those are set, and then they'll sell the insurance. And then a lot of times, like through your job, they'll, and these are just arbitrary numbers I'm throwing out. So this is not
right. No, I get it. You're fine.
So like they may sell the insurance for like $500 a month.
Right.
And then your job say, okay, well, we'll pay this portion.
Because they cover it. The job covers it. Right.
And then they give you the other portion. They'll say, well, you pay this much.
Right.
Now one thing I find a lot of people, the problem that they have with insurance, that they have the wrong kind of insurance. You can make sure that you have the right kind. And
okay, hold on one second. I'm gonna take a pause. I'm gonna get Pastor in here on this conversation. Hey, good morning, Pastor McCory. Great morning to you.
Good morning.
All right. So we found out. So if I'm not mistaken, basically paying that deductible or paying that fee when we go to the doctor is kind of like a gateway to keep from me coming. Hey, my nails looks like it's off centered. Is there something wrong? I was looking at WebMD and said I could have web fingered.
Exactly.
Okay.
People, hypochondriacs running every
right.
year. So.
Right. So it's kind of like a gateway. Makes sense.
Yes.
And then you said the insurance can be regulated based on where you live. If there's a higher, lower mortality, they call it, right? Like if people are dying younger and that area, listen, we got to charge more because whatever's going on in your area is killing you guys quicker. So you're a bigger risk. Okay. So you're going to be going to the doctor a lot more, basically. All right. And then making sure we have the right insurance.
Right.
Right insurance. All right.
Yes. So, most insurances are going to be like, they're going to have a deductible. Right. Because again, it's like, and all of this is expensive. So whatever you're paying, the company's paying a lot on the other end that you probably don't see. And then there's the negotiated rates or what have you. So I tell people the insurance you need is based on how healthy you are. Now, if you're like me, I'm healthy. I don't have any chronic illnesses. I really don't go to the doctor a lot. So I would suggest someone, if you are in absolutely great health, you need to get a high deductible health plan. So it's going to cost you more per time you go to the doctor, but you don't go to the doctor that much. And then, a lot of plans, they'll have a health savings account or a health reimbursement account or something like that. Now, a lot of companies, they'll match. They'll give you, you can get $800, $500, however much. You can put that aside. And you can also save some out of your paycheck to go into that. And it's really just like a regular savings account. It's like another savings account, and
flexible spending account.
Flexible spending account. You get the card, you can use it, but you can only use it for medical expenses. But the money you can use that account just like a regular bank account. So the money that you accumulate, and I've seen now that there are certain schools of thought. I've seen some people that say that you shouldn't spend that money. If you go to the doctor, spend the money out of your own pocket and invest that money, because like if you get the I believe it's the health savings account that rolls over every year, you can just use that. Or you can just use the card for your prescriptions, doctor's visits, or what have you, and you can just like stave that off. Because my philosophy is spend as little of your out of pocket money as possible.
Right. That's how.
So now, if you go to the doctor a lot, like if you have diabetes, if you have a chronic illness where you go to the doctor a lot, then you want it to be lower. So you want a lower deductible, but it's going to cost you more per month. Right. But over time, once you hit your, then of course you have your out-of-pocket maximum. You have, once you meet your deductible, then the co-insurance and everything kicks in. Then the price it sort of balances out. So that's why you have to understand your actual insurance needs and do that. And then with deductible and the way people think, they'll say, okay, well, you may have a $5,000 deductible. Right. People think that you have to spend $5,000 out of pocket before your insurance kicks in. But even then, as I say, if you stick with your network of providers, you'll have discounted rates. There's co-insurance. Like I know I have not met my deductible, but whenever I go to the doctor and get lab work done, and when you get your EOB, your explanation of benefits, I'll look at how much this test cost, which might have been $700. The insurance picked up, a bulk of that, and I probably had to pay $60 out of that, $700 test. So
100%.
Yeah, that's how that works. So again, in emergencies, of course, emergencies are expensive anyway. Right. Now, one tip and trick that I would tell a lot of our and again, this is me speaking, how I do it. Not this.
Okay. It's not cancel. I got you. You're good.
Y'all know this. Y'all hear me say the Book of Brian.
Right.
So, it's especially like a lot of our marketplace. So when you hear like the people, they'll say zero premium health plan. So like if you make below a certain amount of money, then the way like if at my job with my health insurance, CareSource pays a part of that. Then your taxes, you can get the tax credit, and then whatever. So like if your health insurance is $400 a month and your tax credit is $500 a month, then that basically pays you, and you don't pay any money out of pocket. Okay. So what I would tell people is that as much of that money that you would have been paying, put that off to the side. Save that just for this. I know it's hard to save. I know it's easy to save because I'm in the same boat, but you just have to be disciplined and do that. But also utilize like affordable health services in your area, like the federally qualified health centers, FQHCs. Like if you live in Metro Atlanta, you have Southside Medical, you have MedCure, formerly Oakhurst. You can go to the health. So some of the basic health things that you need, places like that, if you depending on your income, they may have sliding scales, or like you can get certain things at a lower amount, so you don't have to spend that money coming out. And then when you do have an emergency or whatever, you can, you won't
be caught off guard with it.
Caught off guard with that. And then of course, another thing I always tell people, two of my favorite words in the English language are payment plan. Find out if they have a scale. Let people know. If you say, hey, and find out from the top, because a lot of places they know that we are working people, so they can. And if you find a place that won't work with you, then I would suggest find somewhere else.
Gotcha. Okay. All right. That's it. Listen, we got already a plethora of information. If you guys have any questions for Mr. Reggie, I know his full proper name. He always put Reggie Johnson. Feel free to ask in the chat. And like I said, I get the deductible. That made sense. I guess I don't like it, but it makes sense. And understanding where you live. I mean, I guess in the sense that does, because you're an insurance agent. Insurance have underwriters, and they gotta you're always weighing that out. So what?
And that's right. Another thing is, and a lot of the insurance they have incentives, ways to make money back. Healthy activities. I know through our Medicaid plan, we have our rewards program. So we incentivize, and our members and their families can earn money for going to the doctor and taking that, checking out. But I know my plan, if you go to the gym, like some plans have free gym memberships, you can go there, you can earn money, they can pay for that. They have health challenges you can get, so I always say, look for the hidden money, look for the hidden dollars, all those things, like the emails that they give you. They say, we're doing 1,000 plank challenge this month. You can do, 1,000 hours of planks or whatever. Do it. Right. Because like the healthier you are, the less likely you are to go to the doctor. So if they give you these opportunities, take advantage of them.
Okay. Awesome. Did you have any questions, Pastor? Like off the top of your head or something?
No, just a statement. First of all, thank you for coming on and sharing this information, Brother Reggie. I appreciate it, man. It's a blessing. I have experienced this all too well, having lived life with a son with special needs. And so I've had to learn every trick of the trade. And I'll tell you, those flexible spending accounts, man, you are right. I am telling you, I received a check for $13,000 playing the game right in 1 year. Right. I mean, I'm just, no kidding aside, that happened and it shocked me. Right. But like the our organization, when you're not a smoker, when you're not a drinker, there's always those promotions that they have that save you money, that there are incentives for you to do. So my only statement is no lies detected here.
It took me years to try to figure this out, because I know there's a lot of times, and I work for an insurance company. I understand it. So so you got to figure it out.
Yeah, I will attest to the flexible spending plan or the health saving plans. When I was working at Costco, and every company is structured differently, but the way they worked, you already got to put the disclaimer out there. He said when you cuss once in a while, he said you got to put there with them. Like I would allocate like $1,000 or $2,000 to go into the plan with them, because I committed to it. If I had something that I needed, they would still cover it with the help with the money before I even put it in there.
Yes.
When I found out, I was like, oh, let me increase that, because I mean, and because
you forget it's your money.
Right. Exactly. And I'm with you, Reggie. Like, I'd rather it already be covered than coming out of my pocket. That's always the best way of thinking. So if you just stepped in here, we're talking with Reggie Johnson from CareSource. We are talking health insurance. And so what's one of the, and you might have already mentioned it, least utilized products in health insurance? What's one of the least utilized products in health insurance?
Oh yeah, all the incentives, all like say the hidden money. When I'm out, if I meet one of our Medicaid members, the first question I'll ask is, "Are you in the rewards program?" And almost like 80% say no.
Wow.
And I'll get their information, because at first I was telling them to do it, but of course people, they leave and forget. So I just say, give me your information, and I'll pass it on and get it in there. Right. So when I was at with my previous job, when I was at Aetna, they had a program where and everybody, so it was like my children and myself, we qualified for that. I don't think they do it anymore, but if you could submit your like proof of workouts or whatnot, and after you reach a certain amount, you would get, they would give you $100. You could either get it in your account, or you could get it off your monthly premium.
Wow.
So there are ways to lower that. So and again, it like the health challenges, people need to take advantage of those, because it makes you better. So go out, if they say do like the burpee challenge, try to do them. If they say walk the miles, go out and walk them, because you get those incentives. And then with our insurance, we use Vitality, so you can get the points. You can go on and get certain shop in the gift shop. So Yeah, those are some of the least utilized advantages, and because it makes you healthier. You can actually earn money or just money off your deductible, how much you pay, and it's just a lot of times it's really fun to do. So
awesome. All right, Sam had a question. Do you know why doctors are so picky about what type of insurance they accept? And right before you answer that, coming to the stage all the way from North Carolina by way of North Dakota. I just threw another state in there. Now, I think in Missouri, Mr. Terry Little.
Wait. North Dakota?
He's around here, up there somewhere around there.
Boy, you making my head
not closer to Boise, Idaho.
There you go.
Idaho. I couldn't think about the potatoes. He said, "Do
North
the
Dakota
and get a gift card to Popeyes."
All right. What's up, you guys? Hey, what's going on, y'all? Hey,
Morning,
Liz, what's going on? How you doing?
Hey.
What's happening?
All right. Oh, so doctors picky insurance. Why they? I think I know because you kind of answered in the beginning. But go ahead.
Well, yeah. So that's a personal thing. I swear I have no idea because I like even with carousels, I hear certain members they'll say, "Oh, this doctor told me they only deal with these plans and not this plan. And this doctor said deal with that plan and this plan." So it's the incentives. Some doctors, some insurance they offer better payouts, better percentages.
Right. I was gonna say that, yeah.
Yes, stuff like that.
There are several things that contribute to that. To your point, Reggie, it is the incentives. It is the type and your payment infrastructure. The process by which you are paid makes a difference, right?
That's it.
If you have legacy infrastructure that creates delays in getting paid, getting compensated, that's going to be a problem. So you have to be on the information technology edge. So you have, electronic services, that type, e-health, those types of things.
And also, the process of like pre-certification, a number of I know with CareSource, a lot of our procedures don't require pre-certification. Other plans do, and the doctors tell me that. I'm saying, hey, that's good for me. So that's a selling point for some of them.
Nice.
Securities, all that. I mean, I have supported hospitals. I've supported healthcare insurance providers as well. But you see the real impact when you hear the complaints or the challenges that hospitals, the people that actually see patients, are facing. Right. The reason why, a lot of things changed around 2006 in healthcare, where everybody had to go to electronic healthcare records and all of that stuff. There was a new layer of compliance when it came to healthcare that kicked off around 2005, 2006. So every hospital in America had to upgrade their IT infrastructure to be able to maintain and support and fall in compliance. And they had, and there was funding that was given to that. And so now, if you're behind from a technology standpoint, doctors aren't going to want to deal with you because you have manual processes, legacy-based processes, and they don't get paid on time.
Gotcha.
Yeah.
Gotcha.
And then to Reggie's point, the incentives are critical. The subcontracting that takes place, transcriptionists, who's handling your processing matters to doctors, to hospitals. All of that stuff plays a role.
Nice.
All right. Capitalism at its finest, right?
Yes, definitely capitalism. Capitalism.
That's great.
But
you know what, Eddie?
Before
you get started,
I'm about to throw it to you.
Somebody told me, I'm not sure who it was, not sure if it was Brian or you, that we up on 500 episodes. Is that?
Yes.
Oh, wow.
Yes, we're celebrating this week. I just wanted to have Reggie on to talk. Reggie. To talk about kind of insurance and stuff, but definitely we're celebrating 500 episodes this week.
That's crazy.
Yeah, we're actually over, but yeah, this week is our designated. Yeah, definitely to kind of highlight that. We've been in this game a little bit.
Yeah,
it crept up on him. It crept up on him.
It did. I was looking at YouTube one day. I was like, wait a minute.
He's like, are we up to 500 yet? Wait, we're 505?
Right.
Yo, that's lit. Like, but you know what though? I'm thankful for my time, man, in Brothers Legacy, right? Because I remember AD, it was just me and you.
Right.
Excuse me. And then we brought on that. We brought on another brother, you know, and then that kind of went left, and then we bring on Pastor Brian. He been with us. Hey, Sam, and we bring on Pastor Brian. He been rocking with us for a long time, man. I'm proud of what you're doing, man. I'm glad that you still rocking and doing your thing. I know. I was down there in GA last week too, and I was like, yeah, I couldn't.
Came in and
I was moving daughters to college.
Bro, listen.
Right.
Listen, I got to Atlanta. I had never been to Atlanta.
Oh, really?
So, no. We had an Airbnb up in Blue Springs. And so we was like, well, we're going to go to Atlanta. We're going to go to the aquarium and all that jazz, right? Let me tell you something. Now, I'm driving my truck. I ain't with all that.
Yeah.
And I get to Atlanta, and my anxiety got on 100,000.
Oh, it ain't for the week. It is not for the week.
Atlanta is not for the weak at heart. I was like, listen, if you're watching this and you ain't never drove in Atlanta, please, if you ain't ready, don't. You know what I'm saying? Because
see, you validate my speech at the end of every broadcast now.
Oh my God.
Say, stop speeding. Yeah, definitely. It's crazy. Crazy.
Don't do it. But I did get to see MLK. I did go there.
Okay.
Ebenezer was closed. I couldn't get into Ebenezer, but I got to see everything else.
Right.
That's because Pastor Warnock out there campaigning.
You gonna say that? I didn't go.
Yeah, they had to shut down. They was like, "Yeah, you can't go in there." I'm like, oh.
Yeah.
But then I had all of my grandkids and my daughters. Let me tell you something, dog. If you have multiple grandkids, don't go to MLK. Don't do it.
Don't do it.
Okay, don't do it. Because it's something about that darn reflective pool that gets them every time.
Oh.
And
wow.
My son, now you guys know my son's autistic. And so he's seen water. It was over. He was like, I gotta get in there. And I said, son, you can't, that's sacred. You can't do that. Daddy, I don't care. I'm taking my shoes off, I'm getting in there. And he meant it. And he got in there. But they didn't They didn't give us a hard time though. They didn't give us a hard time. But it was pretty cool. Atlanta ain't for the faint, and it's not for the faint, bro. Yeah.
Well, glad you came through. Next time, slow down. We'll get to see.
And the thing, I know, right? See what it was. I was gonna pull up on Pastor Brian Sunday. So we left out Sunday to come back.
Okay.
And I was like, you know what? I'm gonna pull out and pull up on Pastor Brian. Then I looked at the directions, and I was like, wait a minute. That's like an hour and a half.
Yeah, everything's far, sir. Everything. Always know that.
I told my wife, I said, honey, look, I love that man of God with everything in me.
When you gotta drive, an hour means a lot, right? Yeah. Throwing another hour on your trip, like,
oh man, and going backwards? Nah, I'm good.
Oh man, so you had to go back, so you're adding an hour plus an hour.
Yeah,
that's additional too.
Jonesboro South, and I had to come back up to Blue Springs and go through Tennessee and all that. I'm like, yeah, I love. I sent him a love offering or something. That's a long way. That's a long way. Man, what's been going on, man? I miss you guys, man. What's been going on?
Everything, brother. Everything. Today, as you can see, we got my man from Care Source. So I'm gonna ask you. I got, of course, my last question. Then we can kind of freestyle. What's one thing to consider when purchasing health insurance?
So, again, your health status. How often you go to the doctor? Because again, it's like if you go to the doctor all the time, you want it to be as cheap as possible.
Right.
If you don't go all the time, then you don't need to pay that much for your health insurance. So, so that's the main thing. How assess your health needs. Exactly what do you need, and that's pretty much it. That's the main thing. I mean, if you I guess how can I put it? Like, in a way, consider your lifestyle. So, like, if you're the type of person on vacation who likes to go like bungee jumping and hang gliding or whatever, then you're probably gonna need, if you're like an athlete, somebody who trains a lot of things and suffers a lot of that. So, so you may, but
like my wife.
Should there be a consideration between like say you're doing it, like you have a family, man, female, children, or if you're single as a male or female, should insurance, or pretty much they all kind of do the same? It's just all about the money going in.
It's pretty much say so. Like if you if you have children, again, depending on how much money you make, and where you live, like you may, in Georgia, if family you have a few kids, you may qualify for peach care.
Right.
So which is either free or may be up to 30. I don't know how much it is now, $30-$50 a month for your children, but you got your kids. So they there are lots of programs for kids. So kids are pretty much taken care of. So a lot of time the adults should pretty much only consider it for yourself. But if you're fortunate enough to make a lot of money or whatnot, then it pretty much is the same. Now the incentives, are different because like you have, babies, of course, they're going to want to incentivize doing the postpartum and the well baby checkup. Kids, they definitely want to incentivize those health checkups and want those things. So
so, just true.
So like I say, see, well, I always tell people, see what you qualify for. Is if you qualify, they call it CHIP, and right, if you qualify for that, get it. There's no shame. Like it's your tax dollars fund is if you work and you pay for it. So
there's no shame wherever you at.
I
love it. Man, that's truly.
That insurance is deep, yo. That's some deep stuff. $2.5 million.
Yeah, and but the crux of the key is to try to stay as healthy as possible. You need to exercise, eat right. Don't stress. So like that's one thing over the years driving in Atlanta, you could either become that rage monster, or you can. So like what I already know I'm gonna see it. So when I see the traffic, I just
it took 5 years off my life, bro. 5 whole years off my life.
Now you can't do that. You got to breathe. So
Father, look here. I can't even. Not even. I'm flying next time. Yeah, I ain't driving.
Well, but I think Reggie, to your point, most people, or I'm not going to say most. I'll say, on average, people typically don't read the information. The Bible says, "My people are destroyed for lack of knowledge."
Yeah,
right. Yeah, we don't read.
Hosea, right? And that's because you don't even think about the many types of plans that there are and how you need to match a plan to your needs. You just are happy that they provide healthcare. Right. Yeah. So it's really critical. And again, I only know this from experience because of having a son with special needs, having dealt with children with asthmatic conditions and eczema, things of that nature. And so from a financial standpoint, you have to figure out what meets the needs of your wallet.
Right.
But primarily from a healthcare standpoint, what meets the needs of you? There's a difference between, a PPO or HMO, right? There's a difference between a regular hospital and a Kaiser system, Kaiser Permanente, who runs their own healthcare plan.
Yes.
They're still around? I didn't know they were still around.
I'm just saying.
They heavy here.
Really?
Heavy here. Yeah.
Oh, wow.
And in the West Coast, on the West Coast. The West Coast, they're everywhere.
Right.
And so it's those types of things. You got to recognize that you could get into a plan that doesn't even support what you need, what you're trying to do, and you could be stuck. Right. That's why open enrollment. That's why it's every year. You have to reevaluate every year because your situation may change and healthcare plans change.
Yeah, right? And also, I'm sorry. Yeah, and also the qualifying circumstances. If you move, if you get a new job, if you
divorce,
anything. If you, and there's nothing I tell people, like if you're an entrepreneur, if you start a new business, ma'am, that's an open, that's a qualifying experience. And another thing, while you were talking, Pastor, I'm trying to get my train of thought back, but
right, there we go. Can we get that?
You had mentioned something before. What did you say?
About.
I'm sorry.
If you can't remember, I tell you I'm not gonna remember.
Do you know what's the difference between HMO and PPO?
So yeah. So HMO is like a health management organization. Basically, they have the doctors. It's basically just like they have their own doctors,
like Kaiser.
Yeah, right. Like, you're talking about the
Blue Cross Blue
difference
Shield
between someone that's in network, where it's going to cost less, it's going to be easier, versus someone who's out of network. Where it will cost more. You may have to travel further. It may take you longer to get. I mean, it's all types of things.
And so PPO is like.
Because HMOs don't have out of network. You can only see doctors in that network. PPO, they have it's our provider. So you have in network and you have out of network. But of course, they're going to want you to see the in network because it's cheaper for you and it's cheaper for them.
What did PPO mean again?
It's preferred provider organization.
Preferred. I got you.
In network. We prefer you have doctors that are in our network.
Right. Mm-hmm. But I've noticed you're right. It's not as bad if you go out of network with the PPOs, but the HMOs, because the way they're set up.
It depends on the provider.
Right. Indeed. I'm sorry.
Because they don't all have the same types of relationships.
Right. 100%.
You know, the same type of contractual commitment. You know, if you tell me, I'm only going to send my patients to you. Right. Then I get the bulk. We're measured in quantity versus quality.
Right.
Right. Yeah. So all of those deals are being made. Let me ask you this, Reggie, because CareSource is a non-for-profit, right? You all are non-for-profit.
Yes.
Okay. And you provide, plans for Medicare, Medicaid, but also you do regular open commercial plans as well.
Yeah, Mark. You know what? And that's okay. You said that. That's what I was about to say. And it was about the marketplace affordable care, AKA Obamacare.
Right.
You know, and another thing about health insurance is it's political. And especially over the past, with the last, administration, if you listen to what they say, they're going to tell you about so that there's a lot of disinformation out there. So people come in automatically with that wall up, thinking that it's all. So when you try to explain to them, they a lot of them can't really hear. So it is political. But now to get to that, so the on our nonprofit side now, that a lot of that mostly deals with our Medicaid plan. So with that's our life services component. So through that, we provide, and Georgia is the only state that has this particular model, because in other states, you have to be a CareSource member in order to go through the life services program. But Georgia is different.
Okay.
Primarily because we didn't do Medicaid expansion. So in a lot of other states, the people, there are people who are, qualified for Medicaid, they don't qualify for Medicaid in Georgia. Right. So, and we utilize that to address some of the social determinants of health, because, health is one of those funny things, because it's the most important thing that we have, but it's also at the bottom of the total poll in terms of importance.
Right.
Because like an example that we use is, say you're a low income family, and your lights are off, you don't have any water, you don't have any food, and your child, and your youngest child has a cold. Well, the lights, gas, and food is going to take precedent over the cold. And so you do that, and then eventually over time, if you don't handle the cold, then the cold may progress to, pneumonia, bronchitis, and whatnot. The next thing you know, you end up in the ER. Right. And so on top of the lights, gas, and water, now you have a $900 ER bill that you have to. So with that, so we have our programs and staff to help our members address those issues. So and I always tell people, we don't provide, so we don't pay the bill for you, but what we do is and that's another part of what I do, is build the relationships with the organizations, their government organizations, community organizations, whatnot, that assist. So if you need food, we actually partner with food banks. We provide our members with free rides to food banks. So if you need to get to a food bank, you coordinate with your life coach, bam, we can get you to the food bank and back, no cost to you. We provide life coaching. So anyone 16 and older can sit down and talk to a life coach that follows up to 2 years. And we just figure out, what's your plan? What do you want to do? Where do you want to go? And if you need a GED, we pay for GED testing, all parts of the test, and twice. So the person that passed the first time will pay for it again.
Right.
We have relationships with all the tech colleges and other employment organizations. So if you say, hey, I want to learn how to be a computer tech, I want to do IT, I want to get a CDL or whatnot, we partner with WorkSource. And I tell people out there, if you're listening to me, if you want to change, listen, what they call it WorkSource Georgia now. So each time you have WorkSource DeKalb, WorkSource Clayton, or whatever. Back in the days, I know they call it Job Training Partnership Act. That was way back in 1990, whatever. But I over the course of my life, I become a certified IT tech, and I got a CDL. Did not spend one dime out of my pocket because that's what the state does. And we partner with these programs with our members. So if you want to get CDL, you want to learn how to be a cosmetologist, phlebotomist, you want to learn how to be.
So coming to you kind of can navigate some of these things or direct.
Yes.
Wow.
We have Job Connect. So we partner members of with the different organizations. So I like a lot of people, they send me things. I send my Job Connect manager who sends them to the members in that program. We do free family memberships to the YMCA, after school program, Boys and Girls Club. We have a partnership with Fifth Third Bank, so our members and their families, if they need a bank account, they can go to Fifth Third Bank. Walk in, just show them your card, get a bank account. It's a real bank account, no minimum service charges, no monthly service fees, anything like that. So those are the partnerships that we've built over the years to help our members, because
I got a new friend.
I know, right? I know. I'm about to ride over to the office. Like, okay,
let me ask you this, because now you've sparked some things, some curiosity for me. Given your background, because you worked for Aetna. I heard you say that about 15 minutes ago, previously. And so you know that it's public. CVS acquired Aetna, right?
Yes.
So in this competitive landscape, when you talk about all the services that you just laid out, I know that the purpose of CVS acquiring Aetna is to broaden, to link consumers with services, right? That that CVS provides. So the promotion of the acquisition of Aetna brings light to CVS and their patient plans for access to resources like prescriptions and things of that nature, but also to manage healthcare plans by bringing in Aetna. My question to you is CareSource a competitor of that new merger with CVS and Aetna? So
yes, and well, all the healthcare plans are pretty much competitors, because we all do the Aetna. CareSource, we really don't do shop plans, which is like through your job. We really don't do that, but we do the other things. So in certain states, Aetna does a managed care like we do in Georgia for Medicaid or Medicare. They have the Medicare plan. So yeah, they do that. So we are competitors. So it's trying to get back over.
Here's the reason why I'm saying this. The reason I'm saying this is because the information that you're providing is not the type of content that you would typically receive from an agent, from a representative. They're not going to go into that level of detail.
Right. That's the point.
Yeah. And so because you're so forthcoming with this, I would imagine, and because I listen to you speak with so much confidence and credibility, that, and also the fact that you work for CareSource, and I have a relationship with CareSource, so I know y'all. I just is what it is. Thank God for that. Familiar territory.
Thank you.
What I guess my point is, what are the advantages of talking to someone like a CareSource representative who comes from a non-for-profit world? Because the minute you say non-for-profit, I say I'm not competing with those for-profit people.
Okay, I get what you're saying.
Drives me is different.
Right.
Your motivation is different.
Yes.
You still got to get commission.
Well, see, so now for myself, now I am I can't the actual terms, but see, I'm an actual employee of CareSource.
Okay.
So I'm, like we now on our marketplace and Medicare side, now we have independent agents. So, they actually work for themselves and they may sell different plans. Okay. So, you may go to one.
So CareSource is just one partner.
Yeah.
Okay.
Yes. So I just work and market and sell whatever. I just specifically for CareSource. So, I'll give like my best friend, he does the Medicare portion. So he's an independent agent. So he does Humana, Blue Cross, Aetna, all those. Okay. So to him, he'll, whichever you like tailor that. So with me, only thing I just know CareSource. Okay. So that's so that's what I can speak of. But as far as that's now I'm learning that there are other nonprofit health insurance companies that are out there. We're the only one in Georgia for right now, but that component is one of the things that really, when I say I'm fortunate to have ended up at CareSource, I really am, because that's the way I say my job is to market and sell CareSource, but my mission is to help the community. Okay. So
nice.
And in my mind, because I feel the mission of CareSource, like I said, is about making a change. Right. I want to ensure that you know everything that you need to know. So like I will tell you everything you need to know about CareSource. Right. But I will make sure that you know the whole picture.
Right. See, that's my point. That's my point. See, one person is talking about a healthcare plan and another organization is talking about quality of life.
Right. Right. Yeah, definitely.
So yes.
That's the difference.
Definitely.
Right.
So we definitely gonna have Mr. Reginald Johnson on a lot more. Yeah. Just so you know him already. Put him on the plan. Maybe if he got a day, we might come on every week and talk about something, because there's always the landscape is always shifting and changing. We definitely
and I see you in the future visiting my church.
Yeah. Yes, sir. And where is that? Where are you?
Where's in Jonesboro.
In Jonesboro.
Okay, yeah.
Yeah, that's right around the corner.
My territory.
It's like you always got to like, yeah. Where you at? Macon? You in Macon? Ooh, okay. Hey. I'll come a Sunday a month.
Right. Oh, somebody had a question, AD.
Yeah, let me ask.
Medicare, I didn't stay at a Holiday Inn Express last night. Reggie, you tell me if I have this right, because one of them, I think Medicare is for people that are under a certain age. I think like under 65, it provides programs. And then the other one is for people that are, is it reverse? Medicaid is under 65, and then Medicare is low income.
Right. Well, okay, so the way I tell people think about it like this. Okay, so Medicaid is income based, and Medicare is age based. So like I said like this: say you aid the poor and you care for the elderly.
Yes.
So now that's the the black and white. Now you can qualify for Medicare. So like if you are disabled for more than 24 months in a row, then you qualify for Medicare. So even if you're under 65, you can get that. And if you're over 65 and if you get Medicaid, if you get Medicare and you're low income, you can get Medicare and Medicaid. So mostly Medicaid is income based and Medicare is age based. That's how I remember the poor care for those.
And that's kind of why they was I've heard a push for Medicare for all.
Yes.
Medicare for all, to get rid of the age and allow a lot more people into the healthcare space.
Yes. If you need it, you should be able to get it.
Yeah. Okay.
Right. Thank you, Mr. McCrory. I like that. I saw in the chat.
Yeah. So we got a plethora of information. Feel free to ask. I always give my pre-closing to the closing. It's watching preachers for a long time. You got to give.
That's because I'm on here, Rich. See, you already did. Because
It's preachers. So the pre-close to the close. So I appreciate you guys for being here, rock with us. Please share this broadcast. Tag somebody that needs health insurance and needs and they're leery. One of the main things, like Pastor even said, reading is fundamental. You need to read the plans and understand what you're signing on, even at work, right? Most jobs, for the most part, there's always like 2 options. So it's like 2 or 3 options to give you an opportunity to connect. All right. Reggie, appreciate you for being here. Thank you for being a part.
Thank you, brother.
Yes, sir. Thank y'all.
And that's the best way to. Is that the best way to contact you, Reginald.Johnson at Care? Contact this brother if you need help navigating. He's a community advocate first. CareSource employee second. Yes.
Don't forget the 3-on-3 basketball tournament, Fathers Matter, October 8th, 11 to 3.
Another part of Dr. Rollins' Fathers Matter tree.
Yes.
Networks are important. Ecosystem matters. Bless you, man.
Yes. Thank you, sir, for being here, man. We'll talk. All right.
Ain't that something?
That was good info.
Ain't that something? Wow.
Yeah. Community, guys. Community, collaborative effort. The thing is, though, you got to show up.
Yeah.
Right? Your peoples have something. Like, hey, come out and just add to the conversation. Make time, because you never know who you're going to meet. You know, Pastor always says you're one handshake, one email, one phone call from your breakthrough. You know, or your blessing. Or your change. You know, like you never your shift. You never know. You never know. And we stress community and connecting all the time. I know we get, because I lived a long time in a bubble. Nah, I ain't got time. I got work. I'm here. I'm tired. I'm sleepy. I got this. Make time to connect. Because you never know what opportunities may open. All right. So hopefully you guys got a lot. I left it the contact Reginald.Johnson at caresource.com, especially if you're in the Georgia area. Connect with him, because he can offer you a plethora of programs. And remember, CareSource is in other states, so connect with him or go to caresource.com for more information. But connect with somebody, connect with him directly. Ask him a question so he can send you to the right space. So make sure.
Oh, by the way, and CareSource is my client. I designed their entire IT infrastructure.
Gotcha.
So I'm patting myself on the back.
I see it.
This morning.
Never miss an opportunity. You never miss
okay, you better say it. To God be the glory.
Hey. All right. So we're gonna get out of here. We appreciate you guys for being. Terry, he couldn't stay long, you know, he was in the car. Appreciate you rolling through. We're in our 500th episode, just bringing some folks on. What's tomorrow? Friday. Got more surprises coming. I made sure I didn't tell Pastor any of this holding stuff. It's hard. We have conversations like, don't tell them. So Friday, hopefully, I got one more surprise coming through. So again, I appreciate you guys for being here.
Don't make me cry, man.
I don't know. Maybe. Oh yeah, we're gonna get a cry here live on Brothers of Legacy. So we appreciate you guys. Make sure you share. Make sure you connect with other people. Stay connected to us. Text LW into 84576. As always, all hearts and minds is clear. We love you, but God loves you more. Listen, continue to stay safe. 988, having a mental health crisis, know someone in a mental health crisis, make sure you dial 988. I'm connected to him to a young lady who is over or an advocate for 988 that has more information. So she's going to have a show in the future. So you guys, like I said, stay connected. You're going to learn a lot in the whole Legacy Walker Network. All right. So we look forward to seeing you guys tomorrow, same time. What's that? He said, we love you, but God definitely loves you more. Definitely. Yes, indeed.
You know you're doing something when people say what you say.
Right.
Thank you, Jeff.
Yes,
Appreciate
indeed,
you,
Jeff.
man.
Yes, indeed.
Wonderful.
Yes, this is great, guys. Awesome. And Sam said, I learned something and great info. All right. So I'm out. No long close. All right. We out. See you in the morning. Stay safe. In Georgia, drive safe. Peace out.